Thank you very much. Good afternoon, and it's a real pleasure and an honor to be here and to partner with Shell on such a socially relevant topic. I'm going to talk about how technology helps. I'm with Hewlett-Packard. I lead our worldwide public sector practice, and it's about a sixth of our business. HP was formed in 1939. Two Stanford University graduates, friends, got together and started this in a garage. Friends to the extent that they chose the sequence of their names by the toss of a coin. It's been socially conscious and environmentally sensitive right from inception. In 1957, well before it became fashionable in industry, we had our first sustainable environmental officer. We've had a number of industry firsts. We were the first in the IT industry to voluntarily publish our carbon footprint. We did last year the water footprint, etc. But I'm not going to talk about what we do. I'm going to spend the next 10 minutes talking about how we help our customers drive better services to citizens and help cities and local governments, etc., become more sustainable. We are living in the century of cities. For the first time in the history of mankind, more people are living in cities than in urban and than in rural areas. But along with that, and we heard that throughout the course of the day, it brings a number of challenges with this massive urbanization that is taking place. 320,000 people moving into these urban areas every day. The question becomes, how do we scale, how do we provide services to these urban centers and create better qualities of life? And we look at, as I look at these cities and as we deliver services, we see these cities as crucibles of a few things. One are places. Places like our homes, our offices, cultural centers, recreational centers, etc. We have a number of things in these cities. Cars, transit centers, conduits that actually deliver and help us go to these places and deliver resources. Oil and natural gas, clean air, water, and all together they deliver a whole set of services. Education, healthcare, and that improve quality of life, that bring safe cities, cleaner spaces, cultural centers, and together drive economic growth and the creation of jobs. And they are all inextricably intertwined. In the model that we talk to cities, you can't separate any of these. You've got to think about the totality of what is being done in these cities. But at the center, it's about the faces. It's about the people, it's about the outcomes, it's about what value do they get from all of those other circles coming together, the things, the places, the resources, and the other services. Why should they care? What outcomes are they getting? Because people today, businesses today have a choice in many cases. Cities are in competition with each other. People have a choice of whether to move to a city or not. And these cities that we live in face both stresses, traffic, pollution, crime, etc., but also shocks. The picture that you see at the top right is Detroit after the financial shocks and industry dying. You have weather-related shocks, and we talked about typhoons, etc. You have terrorism, you have health threats, and the question becomes, how do we create cities that bounce back, that absorb these shocks, and that create a framework that allows the residents of the cities to be at their best, to optimize their potential. And in that, we look at 6 dimensions. It's truly essential, we believe, to understand who's at risk. Because the people who are most vulnerable are the ones who suffer the most in terms of when things go pear-shaped. because the people who have the means either have alternate means of backup, or sometimes they have the choice, which they do exercise, of leaving. We saw that happening after Fukushima, etc. It's a question of delivering services in a better way, 24/7 by 365, and you have alternate means of delivering services. You have innovation in service delivery to use a whole set of channels so that you bring government to people as opposed to having people go to governments, fighting traffic, fighting congestion, etc. Why can't we have the way we transact in businesses today? Putting citizens at the center of design so that the citizen is the part of the design process, and creating these ecosystems of partners, because problems are so complex, the financial needs are so high that no single entity has all the answers or all the capabilities. And then bringing technology together to make it all work, and using technology as a force multiplier. So I'm going to take you through just a couple of cases to see how it all comes together in real life. This is healthcare delivered to the ones who do not have healthcare in many places. It need not be in rural areas. It also happens in cities, in the slums, and in other areas. So could we have the video, please?
India is a huge country. We have about 800 million people of the population that have little or almost no access to healthcare. Folks need to walk, sometimes for days, in order to get access to medicine or to healthcare.
ছোটবেলা আমার একবার পা কেটে গিয়েছিল অনেকখানি, ভীষণ রক্ত বেরোচ্ছিল, কিন্তু এখানে আশেপাশে ডাক্তার নেই। ভীষণ কান্না করছিল কি হবে। তারপরে আমাদের হসপিটাল অনেক দূরে, এখান থেকে স্টেশন থেকে যেতে আমাদের হেঁটে যেতে 15 মিনিট লাগে, তারপরে আবার ট্রেন থেকে নেমে হসপিটালে যেতে আবার হেঁটে যেতে আবার 15 মিনিট লাগে। আমি ভীষণ অসুস্থ হয়ে পড়েছিলাম।
Together with partners, we provide access to healthcare services through cloud computing-enabled e-health centers located in the communities where people live. E-health centers can be set up in existing clinics or buildings, or they can even be deployed in a shipping container if no facilities are already available in the community. These e-health centers are fully equipped with key medical diagnostic equipment, an electronic medical record system, healthcare dashboard, and video conferencing features, which are all fully integrated by HP. E-health centers are staffed by skilled nurses or health workers who can perform diagnostic tests, while the results are available in real time to doctors far away. We connect doctors in cities to the patients in the community. Technology makes access to healthcare possible anywhere in the world.
Thank you. What that does is, because today if you see the demand for doctors, for example, amongst other, by my calculation, you'll need about 4 million hospital beds, 3 million doctors, etc., just because the gap is so wide. And it's not possible to create doctors. It takes 7-8 years to train a doctor. The question is, how do you leverage the people that you have? And it's the technology that kind of absolutely creates a new model of healthcare and hospitals to be able to deliver that. This is a case in Northeast England where we provide services, and here we find that it began with a case of why were people not showing up for welfare interviews. And we thought that maybe they were too far away, transportation was a problem. And then when we started digging deeper, this is big data in practice. You hear about the concepts of big data, but this is big data in practice. When you start analyzing it, you find that they are not too far away. They live pretty close to the service centers. And you begin to unpack the onion and say, what's going on? And you find that these people have real issues. One member of the family may be a drug addict, someone may be in prison, the children may not be cared for. They have too many things going on. And that's when you begin to take an outside-in view and say what is going on with their lives. And we co-opted them. That room that you see is our design center where we bring all the agencies together, including the recipients of this aid and services. And that's what they designed on the left. It's an app that runs on your phone. And the child there, through these simplified icons, can tell you whether or not they went to school, did someone take care of them, did someone feed them, and you begin to build a picture of what's going on in their community. You begin to find out, where is this happening? Are there locational issues? Should we do something with crime prevention or, drug dealing, etc.? And what we find by doing that, you simplify how governments deal with them. There were 31 different agencies that was touching this one case. You've now brought that down. You're saving 10% of the budget. It helps them do more with less, and they create a fabric of their own where they are now creating a self-support system. The pegs that you see are their own network where they are now reaching out to each other and say, if there's something going on with your situation, I'm here to help you, or this is a care provider. It creates that resilient fabric because you've created a network, an alternate network that doesn't rely on the traditional network that exists. So, two simple cases to just exemplify what we are doing, and some lessons learned is, given the scale of the problems, given the lack of money and talent and resources, having insight so that we can focus our resources and drive value becomes very, very important. So what we're doing is leading with insight, leading with technology to really kind of change the paradigm of how we're building resilience. And my opinion is that resilience is not an afterthought, it's built into the normal operating process. So thank you very much.
Suparno, thank you so much. It's great to get some tangible examples there of how technology can sort of bridge that divide between the growing demand for different services and then, also the need to provide them. So